So my name's Kim López. I'm a PhD student at the University of Oxford. I'm delighted to be here. Thank you so much. I'm going to talk about a project that I was part of on long COVID or post-COVID-19. So you probably all know about it. These projects started 2 years ago, roughly. So at that point, what we thought was the prevalence of post-COVID-19 was around 1 in 10 people infected developed these symptoms. That has been contested right now, but estimates still range around 3 to 30, depending on like different population characteristics and risk factors. And we thought, and we still do, that it's a very broad, it has a very broad symptomatology. So around that time, 2022, 2023, Eden, which is, if you hopefully you know about it, it was a big public-private partnership to fund collaborative research in Europe, funded this very big project on long COVID. And one of the studies was the one I'm going to talk about today. So we used the clinical case definition issued by the WHO in 2021 that states that long COVID is an infection plus a relevant symptom of a list of 25 in the period of 3 months to a year after COVID-19. And we gathered partners from Europe with access to European databases, and also a couple of people that joined online from Korea and the US. And we actually, the majority of us met in Oxford in person. So we gathered results and we discussed results together in a week-long study-a-thon. As I said, this was part of a bigger research endeavor, but the particular study that I'm going to talk about had as aim to identify clusters of individuals with long COVID. So basically try to understand symptom patterns with people with PCC, post-COVID-19. So what did we do? We grabbed people that satisfied this WHO definition, so people who had COVID-19 infection, either diagnosis or a test, and then at least one of the symptoms of this 25 symptom list in the window of 90 to 365 days, with a couple more exclusion criteria, like not having the symptoms 6 months before, not having flu or COVID 90 days before infection either. We created the code in Oxford, so we were the data science hub team. We sent the code around to all the OMOP databases, data partners. They sent back the results as usual for a federated analysis. And methods-wise, we used latent class analysis. So that's not exactly clustering, but it's a model-based algorithm to try and infer distribution of latent classes underneath the variables available. So we try to group people depending on their symptoms. We mainly use this long COVID cohort, so the people with 1 or more symptoms of this list. And then we also use subsets of these cohort of 2 or 3 co-occurring symptoms. And the final clusters we characterized using different demographics, comorbidities, as you can see in screen. So this is the sort of output we got. This is an example from CPRD Guell. This is a UK database, primary care. You can see the 3 symptom result for the long COVID cohort. So you can see there's a cluster of people with basically joint pain, a cluster of people that has abdominal pain, anxiety, depression, fatigue, and headache, among others, and then a cluster that has chest pain, dyspnea, among others. So we did this for a variety of number of clusters for the different cohorts and for all the databases. And here you can see the results for all databases for these 1 symptom or more. So the 3 rows for gold are the ones you just saw, kind of like looking from above. The rest are all the other databases. From top to bottom, we've got Cariva is an Estonian database, a primary care and registry. CPRD is primary care in the UK. EDOL is a hospital in France. Hulafe and Imasis are hospitals in Spain. IPSI is primary care in the Netherlands. NLHR is Norway, primary care and registry, and Femetics Plus is the US. And on the x-axis, you've got the different symptoms of the WHO list, plus a SNOMED PCC diagnosis code on the right that sadly not everyone had a count of, and a few demographics on the left. So the main takeaway point of this graph is that we saw a lot of single symptom clusters, which we thought was very artificial and just database characteristics and not particularly interesting clinically. More so is to look at the 3 or more co-occurring symptoms, where we can actually look at like the relationships of the patterns between symptoms. So you can see that we discovered 3 clusters, the ones that you can see in the key on the bottom right part of the screen, that were roughly discovered in many of the databases. A couple more interesting things to note here, apart from that, is that first, for CPRD-RM that had some counts of these SNOMED PCC code that basically correlated with the RFP cluster, so the respiratory fatigue pain one. And second, that the clusters are quite overlapping almost everywhere, which suggests that these post-COVID-19 condition is probably more of like a multisystemic condition than rather different conditions altogether. So take-home messages from this. First, this was, to our knowledge, the first and biggest multinational study on long COVID, and particularly using the WHO definition. Second, we found 3 broadly reproducible clusters, these gastrointestinal one, the anxiety depression, and the respiratory fatigue pain one. There's been some research on long COVID clusters since then. Some of these have been validated, some others have been discovered. Some we couldn't have seen here because of the majority of our databases were primary care. And as you know, we can't see everything in primary care. And finally, from like a long COVID condition perspective, there's been a few studies about risk factors and subtypes, and I think that's pretty, like we have way more information on that right now, but it's still pretty unknown, the mechanisms of disease or the therapeutic avenue. So there's a lot of research to do in that area. Thank you to all my co-authors. Obviously, this is a big enterprise. I didn't do this alone, so thank you, everyone. And you can see some of us here in Oxford when we met in person in the studyathon. If you want to scan to the right, you've got a lot more results that I didn't cover and a lot more information. I'm happy to take any questions later.